Hello and welcome to Maths for Girls at 4 p.m, where we are going to meet three amazing role models who've got brilliant careers that use maths in the sector of medicine and healthcare. So this session is all about you getting some career insights and inspiration into how maths can help you pursue a career in this sector. We've got a particular focus on the United Nations global goals. Now, obviously, over the past couple of years, careers in healthcare have really been in the media, and we've learned a lot about all of the different types of jobs that keep us safe and help us to get better. But the healthcare sector, the medicine sector, is huge and it's growing. So it's really worth considering a career in this sector. So we're going to hear from the first of our three guests today, Katie. Now, Katie works for a company called Novartis, and I will hand over to Katie now to tell us, please, what your job is, what you do in your job, and how you got there.
Hi, thank you. So I'm going to just share my screen if that's okay. So whilst I do that, my name is Katie and I work for Novartis. And we are a global pharmaceutical company. And we have a really broad range of products that we use to help treat people with many different types of disease. And in my role, I particularly focus on oncology drugs. So these are drugs that treat people with cancer. And in my role as an analytics manager, I look after lots of the data that we have on our drugs in the oncology portfolio. And when I talk about data, we have data on the types of patients that we have on our products, potential patients on our products, the sales data attributed to these products. And we work with this data to answer lots of questions that the business might have about how we can further support our patients and reach even more patients with our products. So here's just some examples of where data and math skills come into working with in my role. So a lot of the time I'm trying to identify sort of the best sales, so where we're making the most money from our products, and this can be down to at a hospital level, at a pharmacy level, who is buying these products. And one of the key parts of my role is to identify opportunities for our medicines. So this is really kind of a problem solving thing where you're using maths to try and identify populations of people who would be potential candidates to have our drugs. And hopefully we can find ways to make that happen for them. And this then leads on to making sure that we have access, so getting our products to the right people at the right time. So that's a bit about how maths is used in my role day to day. And I'll just sort of talk quickly about my career and how I've got to where I am today. So at university, I did a biochemistry degree. So this has elements of biology, chemistry, and also maths in the study. So it was really interesting to learn here and further my interest in science and maths. As part of my degree, I did an industrial placement. So during this time, I worked at the University of Dundee. So here I worked in early stage drug development. So I was working in a research lab to identify potential drug targets for a number of pharmaceutical companies in a wide range of disease areas. So maths was used here a lot of calculating different formulas to run experiments in the lab and then to calculate the results of that experiment. So very applicable using maths here and very much at the very start of the drug life cycle. And then I finished university and I went to work for a healthcare market research agency. So here I conducted market research, both qualitative, so using words and interviewing people, and quantitative, so using numbers and questionnaires to identify different problems that pharmaceutical companies might have. So this was things like how many people are using my product versus our competitor products. What is the future intention to use our products versus our competitors, and things like how big is the population of people who have a certain disease and therefore might be potential to use our product in the future. So here I use lots of math skills and included lots of statistical analysis as well. So specifically that type of maths was involved. And now I work at Novartis, as I mentioned earlier, and this is where I now focus particularly on oncology drugs and the UK in particular to understand how we can better get our drugs to these patients and ultimately make patients live longer lives. So that's my career journey. I don't know if there's
Fantastic, thank you. So you started off learning about the development of drugs, so you know how to do that, and then that's really interesting because as a patient you get given the medicine and that's what you need. It's interesting to think about the getting the medicines to the patient.
Yeah.
Is it a very rewarding job being able to do that?
Yeah, it is really rewarding. A lot of the work I do now is working with the patient engagement team that we have at Novartis, who are really trying to ensure that the patients who are on our products are getting the best outcomes from this and are sort of happy to use our products and are getting a good service from us. So it's nice to work with them to see how we can ensure that more people are able to get that level of care and supporting the NHS as well with the work that they do. So yeah, it's really rewarding.
It sounds it. Thank you for sharing all of that information and your career journey. Now we have the medicines and they've been supplied, and we're going to go over to Helena now, who works for the NHS and is going to tell us about her job and how it uses maths and how she got there.
Thank you. So my name is Helena Gregory and I work for the NHS. My job title is Pharmacy and Medicines Lead in North Cumbria, and you can probably see on my background some beautiful images of the Lake District, which is in the north of England where North Cumbria is. So for my career, I qualified just under 20 years ago as a pharmacist, and I started off working in community pharmacy, which is the top picture that you can see there. So spending time dispensing medicines, so having to count things, having to dilute things, and also giving advice to people about their medicines. So talking to them about how well things might work, around their risk of getting a side effect from the medicine in the conversations. I then thought I'd like to try something different, so went back to university to do some teacher training. But then I took that into pharmacy education, and particularly working with postgraduate pharmacists who worked in general practice and also directly with people in general practice. So you might think, well, a pharmacist, they're usually in the high street dispensing our medicines to us. Well, they're now starting to work in general practice as well, talking to patients about how they use their medicines so that they can get the most out of them. So that meant different communication skills. So again, we were still talking about how well will it work? And a conversation with a GP versus a conversation with an elderly patient versus a conversation with someone like Katie that you've just heard from will all be very different in how you will use the maths and how you will use those communication skills. So my interest really from there developed into how do we adapt our math skills so that we can communicate them well and give the same message to different groups of people in different ways, and very much around applied maths, so things like statistics, things like physics that are the backbone of the scientific evidence that me and my colleagues use in our everyday lives. So we just need to make sure that we're making sense to them, and we need to take extra care that we're checking the understanding of what they've got. So if we used very big, long numbers, if we talked into the billions in some cases, then that might be confusing to somebody who can't comprehend actually what does a billion look like. But I'll show you some examples in a minute of how we can do that so that people can understand that a bit more clearly. So this example is looking at the best possible care for people with lung conditions like asthma. And with things like asthma, it's really important that you have treatments to keep you well and keep you doing the things that you want to be able to do so that you can go out and enjoy the sunshine and exercise. But it's become clear over the last few years that some treatments for asthma are better for the planet than others. And we use a lot of these in the NHS because we have a lot of people with asthma whose treatment is really important. So we found out recently through a number of papers that around 3% of the effect of the NHS on the environment, which is called the carbon footprint, actually comes from the inhalers. And some of this is from the plastic that's in them, and some of this is from the propellant that's inside, the gassy stuff that makes it puff out. And people obviously are concerned about the environment. As young people, you're probably thinking, this is my world for the future, so I want to make sure that we keep it well. So having had a look at all of that evidence, gathered it together, we've got the statistics now on how much it makes up of that carbon footprint. We thought actually we need to do something about it. But actually, what does it look like in different parts of the country? So a doctor in one part of the country might prescribe differently to a doctor in different parts of the country, because of different guidelines that sit behind it that interpret the evidence in slightly different ways. And to do this, we have some access to prescribing data. So completely anonymised, but each prescription that's taken is recorded. We don't see any of that, but what we see is it all aggregated together, all pulled together. So for every person in my area, I can see that all in one big clump. And then this is what it looks like to me. So I'm then having a look at the data and saying, actually, for this graph, I've been told that the lower, the better in terms of the environmental impact of the inhalers that we're prescribing, because some are better than others. And actually, we want to prescribe the ones that are better if possible. And you can actually see the blue line in the middle is the average. And then we've got the red line at the bottom, which is where we are. And you can actually see that we've improved from around about the median average to pretty much one of the best in the country. So fantastic. We've done a really good piece of work. But how have we done this? Because ultimately this is about speaking to individual people and making sure that they're happy with the treatments that they've got and that they're working for them. So we might then look at some population level statistics. So this was a questionnaire that was done across England, and we're having a look at the statistics of it. So the question was asked, how willing would you be to personally do each of the following to help the NHS reduce its emissions, its impact on the environment, and to be more environmentally friendly? And about 7 in 10 people said that they would choose a medicine because it had less of an impact on the environment, which was really positive because we can see that it has an impact and we can see that people actually think that that is something important that they want to consider as part of their treatment. So then we have to think in that individual consultation with the clinician, how do we get that across to somebody? Showing them all of this probably isn't going to mean a lot because they want to know something that's very important to them. So we support our clinicians, our GPs, our nurses, our pharmacists in practice with resources that show patients how they can make the decision around what they use. And there are lots of different things that are important around how you use your inhalers, but this one's particularly focusing on the environmental impact. So if I said to you that the most commonly used inhaler has a carbon footprint equivalent to 28 kilograms of carbon dioxide equivalent, somebody's added all of that up to get the top pie chart there, then that probably wouldn't mean a lot to you because you'd think, well, what does 28 kilograms of carbon dioxide look like? But if I put it into something in everyday life and said it's about 175 miles, it's the distance from London to Sheffield in a car. And actually there are other types of inhalers that's the equivalent of only 4 miles in an average car. So if that's something that's important to you, which inhaler might you choose to have in that particular situation? So once we've been through all of that, we can see it right from the beginning, right from the very big data level, through to our local data, through to the statistics around what people think about it, and then through to the individual conversation that a doctor, nurse or pharmacist would have in their general practice with someone to help them choose their medicines. So I hope that's talked you through how I use maths in my work and some of the examples that you can try out as well. Thank you.
Thank you. That was really insightful, especially around using maths and communication skills to get the information across that's important to those different groups of people. And there are so many groups of people that you work with. So being able to put the maths into context like that. I love the pictures at the bottom. Thank you. And especially your work with the environment, being able to use maths and being able to explain to make a difference to the environment must be really, really a good feeling to do in your job.
It really is, yes. And good care for people as well is good care for the environment. It goes hand in hand, one thing with the other, from nature and spending time outside and being able to enjoy, our trees and our open spaces, right through, as you can see, to the treatments that we choose for people, and being able to say, actually, this is something that's really important to me, which I know young people today are thinking about the future of the planet.
Oh, fantastic. Thank you. Thank you for sharing that and taking us through those examples. Now, we've got a third career in medicine and healthcare, a very different one. And I'm going to hand over straight away to Vicky, who works for Chubb, to tell us about her work and how she uses maths and how she got there.
Afternoon. So I'm Vicky De Silva and I work for Chubb Insurance, which is the largest property and casualty insurance company in the world. But within that, I specialise in a practice called the life science practice. So life science is any branch of science that deals with living organisms, their organizations, life process and relationships. But that's all a little bit complicated. So in basic terms, we ensure the companies that develop products that prevent, diagnose, treat, cure either diseases in animals or humans, and all the service organizations that facilitate that. So for example, Katie's organization, who has an oncology product, I'm looking as a logic problem as to how that oncology drug could cause injury, and not the side effects. It's, for example, if it's contaminated and that contamination was to cause a bodily injury to the patient who was receiving it, or in Helena's world, if the advices that were given were to cause a financial injury because there'd been a miscalculation in the data, which meant that actually the results that were provided weren't accurate. And it's that injury that we're protecting, either third parties or the public or that company, so their balance sheet isn't damaged. So we provide insurance for medical device companies, and that can be anything from someone who manufactures a tongue depressor to robotics that are there to ensure surgeons have less tremor when they're conducting surgery on you, or the biotech companies, which is body tissues and cells and gene therapy, and then pharmaceutical companies, which could be anyone from someone manufacturing the oncology drugs such as Katie's company, or a paracetamol that you could get over the counter at Tesco's. And then it's all those service industries that support it. So they are the laboratories and the research and development and the clinical trials. I'm sure in recent times we've all heard of all the clinical trials that happened with the COVID pandemic. For example, we insured the World Health Organization and all their clinical trials to look for vaccines around the world to treat different populations. So this is just an example as to why people buy insurance, and this is where the maths comes into it. So I don't have a crystal ball as to what future losses may occur. So I'm dependent on looking at historical losses and precedents set in the court and the compensation that judges have awarded people who've been injured or damaged, and looking at ways that we can provide the breadth of cover that our customers need to protect their balance sheet and also to protect the public in case they are injured by these companies. So the reason we have insurance is it's about the premiums of the many that protect the losses of the few. So for example, if you look at the revenues in front of us, if a company has an annual revenue of $10 million or euros, they'll not necessarily make a profit to that amount. So if they were to incur a claim of $2.5 million, that would have a severe impact on their balance sheet, and it might even cause them to go out of business. Whereas if they cede a certain amount of premiums, for example, £10,000 a year to Chubb to cover their insurance, they know that they're protected in the event that there is a claim. And because we have hundreds of customers who will all cede a certain amount of premium to the company, ultimately paying out the losses for the few, the capacity within the company of Chubb is there to protect ourselves, because obviously we are looking to make a profit as well, but our customers and the public in case they are injured. And that essentially is insurance. It's a lot more complicated than that, because we have to look into how we build a rate and how we apply that rate to the turnover and wages and property values of our insureds. But essentially, that's what I do.
Thank you for that. Now, I think I've certainly heard of pet insurance. So I've got a dog. I pay for pet insurance. So I know that if she is ill or needs an operation, that the insurance will pay for that. So I pay a little bit of money every month, knowing as sort of a safety net. And I think people at home may have heard of the house would be insured, so the buildings and the contents. But I'm not sure that people have ever really thought about the companies that develop medicines being insured. What would happen if they weren't insured?
Well, that's the risk. If they weren't insured, it would be a risk of the person who was injured not being compensated for their rewards. And as a public, we owe a duty of care to everyone, all our customers, whether you be a manufacturer or a service provider, not to cause injury or damage. But if you are, and you do, because accidents do happen, it's not necessarily a negligence, it's just in a manufacturing process. As I say, something could become contaminated, or if you're at work, you could become injured just from a slip, trip or fall, or from something far more serious. It's our responsibility as companies to protect either our employees or the public from those injuries. If they didn't have insurance in place, then those vulnerable people could be injured and not have the medical care because they couldn't afford to pay for the medical care. And if they suffer life-changing injuries, which can occur, it's that care that they will need for the whole rest of their life that the companies are obligated to pay.
And you mentioned about insuring companies that do medical trials to find new treatments for disease. So if there wasn't insurance either, the people who had been injured may not get the money that they need, but the trial might have not happened in the first place, and we might not have found a cure.
No, precisely. These clinical trials operate in different phases, and it is a requirement by the ethics committee who consider those clinical trials that they have insurance in place to make sure that they are protecting those people, because sometimes this drug, it's the first time it's ever been administered to a human being, so we have no idea how the body will react to it. So it's not necessarily just looking at immediately as to whether or not the drug will work, it's looking at whether it's safe. And then once we know it's safe, we move on to the next stage of the clinical trial to see if it's effective. And as you say, it's imperative, because people wouldn't take part in clinical trials if they weren't sure that they would be compensated if they were unreasonably injured.
Oh, wow, thank you for that. So thinking about your jobs, I'm going to ask you, what is your favourite part of your job? So can we go to Katie? Katie, working at Novartis in drug development and getting those medicines to the patients. What is your favourite part of your job?
For me, I'd say it has to be looking at all the data that we have and finding little sort of nuggets of insight in that data that really allow us to make change to patients' lives and have an impact on the patients that we try and support, and using data and analytical skills to be able to do that, because that is at the crux of being able to find those solutions.
It really is, isn't it? Yeah, thank you, Katie. And Helena, what is the best part of if you could pick one, what is the best part of your job?
I think if you haven't already worked it out, it's talking. So I I really like talking to people, and a big part of my job, exactly the same as Katie has said, is taking that data and communicating it out and networking and sharing it as widely as possible. And really that is the crux of what we do. I don't sit here and think I talk about maths all day. I sit here and think I talk about medicines all day, but the maths really underpins it, because if that wasn't there and that wasn't right and I couldn't trust all of the things that I've shown you, I wouldn't be able to confidently come to you, come to my patients, come to Katie, come to the consultants and talk about it all day. So yeah, it's important that it's right, that it's there, and I just love talking about it and sharing it.
Brilliant, brilliant. Thank you. Vicky, your turn.
I think for me, because life science is such an ever-evolving, complex industry with new technologies emerging all the time, it's being at the forefront of that technology and seeing, just how exciting medicine is and all the different emerging medicines that people are creating.
Oh, fantastic. Thank you. It does sound very, very exciting. Now, we've only got a couple of minutes left, but at Maths for Girls, we share the highlights, but we also like to share when things get a bit tough, when you've really had to dig deep, either in your job or your career or your studies. Was there a time that happened? Just a quick example, or where do you go if you've got a problem at work that you can't get to grips with? What would you do? And we'll start with Vicky this time.
Yeah, I'm very lucky that I work with some other specialists in this industry, and it's essential to us that we share that knowledge because it's such a new emerging risk. I can't possibly know everything that will occur in the life science industry. So it's being able to speak to my colleagues that helps me solve those problems and getting a different perspective on a problem.
Oh, so working with colleagues,
Certainly.
and yeah, because it's new. Yes, so sharing the information. That's great. Thank you. And we'll come to Helena.
Thank you. I would say the same as Victoria, but also looking at the science and looking at the information that's out there. So sometimes it can be an internet search. We have very good information, and as I said, the background. We have people who work in library and medicines information services as well, who can help us find the information that we need when it's not really obvious from a quick search of the internet or a quick look in a book. So definitely finding that information out, looking at the detail is very important in getting to the bottom of it.
Oh, thank you. And so there are people whose job it is to answer questions from professionals like yourself. It's their job. So you're expected to ask questions.
Yes, they would have a look at the scientific papers that sit behind all of this. So I might look at a news article and think that's quite interesting. I would like to know where that comes from. And then I would say to them, please, can you tell me a bit more about this? And I've got a particular patient with this problem. And then they would help me find the detailed information to help to link that together.
Oh, that's great. Thank you. And Katie.
Yeah, I think to echo what Victoria and Helena said, and use the people around you to support you, and build a network of people with different backgrounds and different skills, because actually you can really leverage from them their skills, and together, as a team, you can often overcome a lot of the barriers that you faced. And also, don't be afraid to learn and ask these questions that you might be scared of and you might think are really silly, but they never are, and people are always willing to help you to understand more. So yeah, just be brave and ask the questions.
Oh, well, that is a fantastic note to end on. Don't be afraid, be brave to ask the questions, and yeah, ask the questions and learn from other people. That's fantastic. I would like to thank all of our guests who've joined us for this Maths for Girls at 4 p.m. today. And this video is on our YouTube channel on demand and on our blog. And look out on our website for further Maths for Girls events coming up soon. So thank you, everyone. We hope to see you soon. Bye-bye.